basic hand wash. You just do circles like this. Yeah. And then after we do our basic hand wash, come here, check the OR schedule. And today we're in OR room number 3. We're doing a radical mastectomy. What we do is wipe down the surfaces of the OR. Now the next step after we wipe down all the surfaces in the OR is to check all the equipment that's functional. We need to work. So now we're going to go check the light. Now we have the custom pack. We can check for the integrity. There's no punctures, holes. Okay, so now I'm going to open my basin. So away from me. Now we have a vessel loop to identify the long thoracic nerve, so we can put it, out of the way so we don't nick it. Next we have our clips, our hemo clips. Next we have 3/0 silk, and this is used to hold the drains, the two Jackson Pratt drains that we're going to leave in after surgery so we can drain the wound. We have a 130 gauge needle. This is for to administer the 2% lidocaine. And this is a number 10 blade. We're going to use a couple of these for this procedure. They're going to get dull real quick because the skin is a tough tissue, so it's better to have more than you need ready to go. So now I'm just going to open my gowning gloves, and after that I'm going to open my instrument set. So now I'm checking the indicator locks. They change color, they're good. Meaning it's sterile. Now I'm going to check the filter, see if it changed color. They changed color, no perforations, no holes. So now we're going to start doing a hand scrub. So first what you do is get the nail pick and
doing.
so now I just scrub. Now I'm drying my hand. Careful not to touch any part of the towel with my scrubs. So these we need two rakes. They're used to retract skin and muscle tissue on the breast. These are three extra Alice clips, and these are used to grasp the tumor and breast tissue. Okay, so these are hemo clip pliers, and we used to grab the hemo clips from the clip to apply it to bleeders. This is a skin stapler, and we're going to use this at the end of the procedure to close up the wound. Okay. These are two Jackson Pratt bulbs, and these are used for post-op suction drains. This is the Curlix and the Coban, and we're going to be using this today as our dressing. Checking my instrument set. So first I check the indicator. Indicator is good. Good. Now I'm transferring it over to my back table. And this is when I would start my, first we do soft count. After we do a soft count, then we would do our sharps. After we do our sharps, then we would do our accessories. After we do our accessories, then we get into the instrument count. Now I set up my mail stand, and I'm gonna put all the instruments, all the items that I'm gonna use for my procedure on the mail stand. So first I'm going to explain the incision, what we're going to use for incision. So first it's going to be the marking pen, right? So we're going to mark the incision site. After we mark it, we're going to make the actual incision with the blade. Then further dissection with the metal bombs. Then skin's a tough tissue, so we're going to have to change that blade out. So that's why we have needle holders. We have lidocaine on the field, which I'll show later when we draw up the medication. So as we keep dissecting, we're going to need to use the rakes to hold the skin and separate the skin, hold it tight. And after that, we're going to need to go into hemostats. And then we have a variety of hemostats here. Just depends on, you know, what we need each one for. And then we have the hemo clips, so we can clip each vessel and stop the bleeding. Then we're gonna have the lap sponges, which will also help us stop bleeding. So here I just put the vessel loop on the schnitt, and this is used to identify the long thoracic nerve, so we won't accidentally nick it while we're doing our dissection. On my back table, this section is for my sharps. So this section is just for my sharps. For my medication, then I have my irrigation section right here. Then we go to my forceps. We have my tooth forceps, my non-tooth forceps. Now we have the drapes for the procedure that we're going to use, and this is the gown and glove for the surgeon. Now this section is, I have all the items I need for my closing. For For medications first, my circulator is gonna read to me the medication she's gonna hand to me, and then and then I have to read it back to her to verify that I understood what she has handed over to me.
And this is lidocaine, 2%, 30 mLs, and expiration date is 7/20/20.
So I'll read back to her. This is lidocaine plain, 2%. Expiration date is 7/20/20. So now you always have to label your medication so you don't get confused. Happens a lot. Now we're going to do the Ghanaian government of others, specifically the surgeon. So now the circulator is going to prep from the umbilicus all the way to the neck, including the axilla, all the way to the end of the hand. Now we're gonna start, and we're gonna measure our grips. So now the last part of this is going to be we call timeout. And what do? We need the name of the person, first and last name, the medical number, date of birth, and location of the procedure, and the purpose of the procedure.
Alright, as the circulator, I'll go ahead and start off. We are doing a right radical mastectomy today on Catherine Parsons. Her date of birth is October 31st, 1960. I have already verified her information with her bracelet, and Dr. William Halstead will be joining us today for this surgery.
So, instrument, back table is sterile. We have no implants. The patient is not allergic to latex. And the medication is going to be 2% lidocaine plain.
Wonderful.